We're so glad to see you back on Wisconsin Women. If you aren't sure what this beautiful set is, we're actually in McFarland at a new med spa. And if you had a New Year's resolution to get to the gym more, it's about this time of year that we sort of fall off. We got you covered today. We're talking about Cool Tone, and the experts here are going to tell us how you can tone up those muscles without going to the gym. Now, you probably also want to get in your best health. We've got the expert who can help you with that as well. This is Dr. Ashley with Forward Natural Medicine. Thanks for being here.
Yeah, thank you for having me. Yep.
So there's a lot to talk about when we have you on the show. One of the things, it's hard to narrow it down, right?
Yeah,
One of
really.
the things we're going to talk about is digestive issues, and this can really affect a lot of things in the body. What are some of the most common things you're seeing?
Yeah, when I see patients in my office, especially my thyroid patients, a lot of them are having heartburn, they're having bloating or distension, even if they're eating clean, constipation, diarrhea, foul smelling gas, you know. Those are the most common ones. So.
Interesting.
Which is unfortunate. And there's over 70 million Americans that have like digestive issues. So I think a lot of people are uncomfortable talking about it, but it is really common and it's not normal. So.
I think too, you get used to it, right?
That's a good point.
Yes, exactly. People think they don't, when they come in to see me at first, they don't bring up their digestive stuff at all. It's until I'm asking more questions, they're like, oh yeah, I do have that. I'm like, yeah, that's not healthy.
That's not fun.
Yeah, that's not good.
But
So
people may not know what's normal. I think that's the
Exactly.
other thing too. Is you know, we kind of go in the what we think is normal, and then we don't
Exactly.
talk about it because no one's talking about it.
Exactly.
So for someone with thyroid or digestive issues, because they're correlated, talk about the relationship of the two.
Exactly, yeah. So, like I said, very related. So if you have any sort of digestive issue, there's so many out there. You can have what's called like malabsorption, like you're not absorbing the foods like the nutrients you're getting. And so there's certain ones like selenium, iron, zinc, vitamin A that are just crucial for thyroid function. So if you're not absorbing those, your thyroid's not going to work. And then I know we've talked about before, it's called intestinal permeability, or a lot of people know it as leaky gut. Have you heard that before?
Yeah.
Oh, I have.
So yeah, I know. Yeah, so if that's going on, that's like the #1 cause for triggering autoimmune issues. And we've talked in thyroid stuff, autoimmune thyroid is the #1 cause for low thyroid function. So called Hashimoto's, in case anyone out there has it or knows of it. So that's how, you know, digestive issues can cause thyroid problems. And then if you already have, you know, first are diagnosed with low thyroid, you know, normally when we eat something and it gets out, that normally takes anywhere from like 19 to 24 hours. But if your thyroid isn't working, that's what tells your intestines and whatnot to move. So if that's not working, it's just kind of sitting in there, and it can take a lot longer.
Wow.
So that's where that constipation and just, so you
Right.
just feel like it's a rock in there.
Not fun.
Yeah, no.
Aren't you glad they're experts?
Yes.
And it's interesting how everything is so interrelated. You might just think you have a little bit of a stomach problem that then could cause so many other things.
A lot of my patients are on something for thyroid, and then they're on, you know, a proton pump inhibitor, or, you know, and then an anxiety depression thing. And it's just, they're all related. Let's just get down to the root of it and why it's happening. So
I know one thing that keeps my husband up, and a lot of other people, is heartburn. How does low thyroid cause heartburn?
So heartburn, if we have low thyroid, we're not making enough stomach acid, so that's called hypochlorhydria, not that you need to memorize it or anything. So most people think with heartburn you have too much acid, and so it's coming up into your esophagus and you're getting that pain. But if you're not, the #1 cause is actually low stomach acid, so you're not making enough of it, and then what happens, I know, is it sits there, and the food starts to kind of like ferment and petrify, and what little stomach acid is there is getting pushed up into your esophagus. And so that's what's causing the pain. But when you don't have enough stomach acid, you're not, you know, things aren't getting moved along. You're not telling your gallbladder to work to absorb fats. Your pancreas isn't spitting out enzymes.
And what do you do when you have heartburn? You take an antacid.
Exactly.
Yeah.
And it's so
Which is so counterintuitive what you should be doing.
And a lot of these medications have only been studied to take for anywhere from 7 to 14 weeks, and a lot of people have been on them for years. And there's research that shows that taking these long term have been linked to Alzheimer's, dementia, and a lot of other neurological issues. So
the key thing here, we have to head to break, Dr. Ashley, but the key thing here is rather than masking these issues and putting more and more Band-Aids on it, Dr. Ashley can help you get to the root cause and solve maybe multiple problems that you're experiencing. We got to head to break. We'll be back with more Wisconsin Women.